My name is Dr. Robert Pass. I'm the Chief of Pediatric Cardiology here at Mount Sinai Medical Center in New York City, and I'm the co-director of the Children's Heart Center. It's wonderful to be here on Facebook Live. Well, continuous cleaning is a term essentially designed to imply that we are very aggressively making sure that our center is safe for our patients. And what that involves is making sure that building services is here many, many times a day, many more than we ever did in the past. Every area of our center is being cleaned continuously. There are people here washing door handles, buttons on the elevator, door handles to the patient rooms, the sink appliances. The bathrooms here are being washed many, many more times than I've ever seen anywhere I've ever worked before. And this is all intended to make this the safest possible environment you could go to when you're seeing us here at the Children's Heart Center. Hand sanitizer is available everywhere throughout the building, and it's basically, you can't walk 6 feet in any of our hallways without seeing it. We have it right outside of the elevator banks, both on the first floor when you come into the building, as well as when you come right out of the elevator. There's hand sanitizer in the hallway when you're walking towards our front desk personnel who are doing screening of all patients before they come into the actual office area. And we have hand sanitizer in every single room, as well as every hallway that patients are going into. So you'll never be in a situation where you will be unable to sanitize. Every examination room in our practice is disinfected between every single patient visit. That slows our practice down, but it ensures that every room is safe, and that is our number one goal. And so, yes, every single room is sanitized and cleaned between every single patient encounter. So every patient and doctor, every personnel in this hospital is wearing a mask, including the patients. And if patients come to the hospital and don't have a mask, we provide one for you. We actually don't have a waiting room any longer here at the Children's Heart Center, and I think you'll see that in most physicians' offices today. And that's because we obviously don't want people to be close to one another because of social distancing. So when patients come to the Children's Heart Center, after they're seen and screened at our front desk to make sure that they don't have any acute illnesses, viral illness, COVID, for example, they are escorted directly into the patient room, which has been previously sanitized. And at that point, everybody comes to them. So there is no waiting room and there's no real front desk. Of course, we have a front desk, but the front desk personnel come to see you in the actual examination room where they'll take the insurance information. You'll sign any forms that are necessary. The goal is to try and minimize your contact throughout the center, to not have you in an area that's heavily trafficked with lots of other patients. If at all possible, we want the entire experience at our center to be in a single room. So that means you're going to do your insurance information and talk to the front desk in that room. The medical assistant is going to do her vital signs, EKG, and other testing in that room. And then you're going to see the patient doctor or nurse practitioner in that room. And if a patient needs a test that can't be done in the room, typically it's in a room that's immediately adjacent to the examination room. The doctor meets with you there, and when the procedure is over or when the visit is over, you're escorted out of the building, and that's it. You don't have to stop at a desk to make appointments. The goal is to try and minimize your time with other patients and other people in the hospital in order to observe social distancing to the utmost ability that we can. Yes, the visitor policies for Mount Sinai can be easily found on the website. You want to go to mountsinai.org/about/COVID-19. These policies are updated every day and are fully compliant with New York State regulations, which, as you know, are changing all the time. So I would encourage anybody who is interested in knowing what the latest policies are at Mount Sinai, which again change quite frequently, to visit that website, which is updated very frequently. I think all I could say in regards to safety here is that it is our utmost priority that all of our patients are safe. That means that we have to make sure that the risk of developing an infection as a result of coming in this building is about as low as it's possible. And I feel quite confident in saying that other than living in your own apartment and never going outside, this is just about the safest place you can possibly visit because of the tremendous number of precautions that are being taken. I'd also remind all of the people who might be listening to this brief video that it is also a price to be paid for not going to visit the doctor. Most of our patients who have heart conditions do need to have follow-up, and there is a danger to not doing that as well. We are fully open here, observing proper social distancing and all of the policies and procedures that I've reviewed with you previously in this video. It is a safe environment to come, and I would encourage you to see the doctor here at Mount Sinai. We are ready to see you. We are business as usual with proper precautions and safety, because we are committed to the health, particularly the heart health of all of our patients here at the Children's Heart Center at Mount Sinai.